Okay, thanks for the introduction. Hello, and welcome to this session on blood banking and transfusion medicine. I'm so glad that you could join me today. So I'm Dr. Hamilton Tsang, and I work as a transfusion medicine physician and educator at the University of Washington Medical Center. Blood banking and laboratory medicine is something that's really important for saving lives and keeping the hospital running. So I want you to think about your future and whether or not laboratory medicine and working with blood is right for you. Are you scientifically minded? Do you want to work with life-saving testing as well as interventions? So today I'm going to talk about how blood is used in the hospital. You're going to find out how it gets collected, who manages blood in the hospital, or who manages blood in the hospital, and how you could become that person. So imagine that there is a motor vehicle collision downtown. The patient is rushed to the hospital and needs 10 units of blood emergently. The blood sample is sent to the transfusion service laboratory and the blood comes down. So where does this blood come from? Who is responsible for doing the laboratory testing? And who gives guidance on transfusion within the hospital? So the answer to that first question is, who is responsible for getting blood from donors to patients? There's one step where you start off in the blood center and where people are giving blood. And maybe you've given blood before, maybe you haven't, but once it's collected from the donor, it's given to the blood banking and transfusion medicine specialists. And those include the medical laboratory scientists and transfusion medicine doctors, such as myself. There's a whole team of other people who are also involved. I'm going to just focus on these two today. Medical laboratory scientists, what do? They have the role of performing the medical testing in the hospital. And this is important for the basis of disease or for the diagnosis of this disease. And this is also important for the testing of things like for transfusion, the ABO blood group of the patient to ensure that he or she gets the right blood. They also manage the testing and processing of blood when it's collected. So the things that they need or the things that they generally do are integrating science, medicine, as well as technology. And this is a career that can be rewarding, flexible, and is very team-oriented in the lab and as a part of the medical team. What does MLS do, or medical laboratory scientists do in the collection of blood? One, if you're at a blood center or such as American Red Cross, or up here in the Pacific Northwest is Bloodworks Northwest, you could be doing donor screening as well as blood donation, collection, and donor testing and component manufacturing. So what do I mean by components? Well, let's start off with talking about what is blood and why is blood important? Well, you might think that whole blood, the blood that runs through your veins and that kind of comes out when you're cut, is just a liquid, but it actually has multiple parts to it that you can separate out from it. About half of it is a liquid called plasma that holds red blood cells, white blood cells, and platelets. So they're kind of like this, where they're in some sort of liquid and they're suspended in a solution, and you have all of these cells that are here in this liquid. So you can actually centrifuge this to separate out blood based upon its layers. So the heaviest cells, the red blood cells, are going to end up on the bottom, and the lightest cells, the platelets that are suspended in the liquid plasma, are going to be at the top. And then in the middle here, you have the white blood cells, which are kind of in the middle in terms of their density. Now, if you can imagine that a unit of whole blood has been centrifuged into these different layers, and this medical laboratory scientist is using this machine to basically push this bag, which has the blood in it, up so that it's filling this other bag here at the top left. So that's due to the separation that you achieve through centrifugation. Now, there is going to be a kind of visual sensor here that's going to determine when the red blood cells have come up to a certain level, and then the machine is going to clamp down on one part of it in order to close off this bag. And just about now, it's going to have the white blood cells layer that's going to go into this bag. Then the machine is going to clamp down on this bag so that liquid is going to, or cells are going to come through. And then you have 3 different bags with 3 different components that you got from centrifugation. And at this point, the MLS is just adjusting the unit and putting in an additive preservative solution um, to preserve the red blood cells so that they'll stay around for longer. And that's just the first step to getting a life-saving red blood cell unit or platelets or plasma or other blood products, such as this one over here to the right, which is cryoprecipitate. But yeah, and one of the reasons why you would separate out these components is just so that you can have them a little bit more concentrated in case there's somebody who just needs platelets in order to get better coagulation, or they need red blood cells for their oxygen delivery, or they need also plasma for also their coagulation so that they can form a clot when they get injured. And there is just a lot of additional processing that can be performed. Like over here to the left is showing leukoreduction. That's where you use gravity to filter out any remaining white blood cells. They have a little filter here that filters out cells of a certain size. And over here to the right, in case you collected a double unit, then you can kind of split up those units and try to make sure that you get the right dosage in the in the units that you're putting out there. And as well, there is also the testing that I talked about. So one of the things is to ensure a safe blood supply. The MLS, or the medical laboratory scientists, are going to be testing for various bloodborne diseases. And some of those are things like syphilis, HIV, hepatitis, West Nile virus, Chagas, Zika virus, prion disease, malaria, and this thing, Babesia, is something that's coming down the line, as well as dengue. So doing this testing is actually very important for ensuring that we have a safe blood supply, and that's what they'll be doing in the blood center. Now, after all of this testing and all of this processing, what happens? So the blood is kind of transported over to the hospital in question, and there people who are also medical laboratory scientists are going to be doing some pre-transfusion testing of the patient themselves. They're going to be doing managing the blood supply to make sure that the right blood goes to the right patient after they do the testing on that patient. And if any sort of adverse event happens, like let's say somebody's allergic to blood, or maybe they form some sort of antibodies, then the medical laboratory scientists, as well as the doctors, are going to manage those adverse events, which can sometimes happen. So if you're interested in looking at what sort of environment that that we're kind of working in, you can kind of go to this website. It's I'm putting it in the chat right now, and this is just basically a virtual tour of the transfusion laboratory. So you can kind of go and like look around and walk around, and you can actually get to my door right in the back here if you kind of make a left over here. Oh, I took that out, but you have to get to the end of the tour in order to actually get to where I'm actually sitting, not in this virtual tour, but in real life. So there's kind of 2 tours over here, but you can get to it through this website. Okay, so here's some pictures of people who are going through a sort of training program in order to become medical laboratory scientists. You might be wondering how, like, if you are interested in that, then how do I get to be one of these people? So the medical laboratory scientist is a program that is an MLS Bachelor of Science program. They call it a 2+2 program. That means the first 2 years of college, you're doing a pre-professional phase where you're getting a certain number of credits and prerequisites in general education coursework. And then the final 2 years has 1 year being a very clinically focused didactic year, and then a clinical internship year where you're going and rotating and learning in the laboratories themselves, and having a lot of hands-on experience and first-hand experience within the laboratory. And this is a 4-year Bachelor of Science degree. Where do they fit in the hospital? So you have various different departments within the hospital, and each of these different departments needs medical laboratory scientists as well as clinical laboratory technologists to do the testing. And some of these are specimen processing, hematology department, chemistry department, immunology, microbiology, pathology, toxicology, and most importantly, transfusion. And transfusion was too important to go on this to go into this diagram. So these are all of the other ones. But yeah, and at the head of all of these are people who are going to be medical doctors who are going to ensure that the testing aligns with medical practice, and in order to also interpret the test, because sometimes weird things can happen, as we all know. Now, if you were interested in becoming somebody who is a laboratorian but is also a doctor, in terms of like transfusion medicine, for example, then that's a little bit longer of a pathway. So there's 4 years of undergraduate, and I've seen a lot of people who have been MLS, who have kind of like gone on to become physicians, and so that could be one stop on your way on this journey if you choose to take it. So there's 4 years of undergraduate, and then another 4 years of medical school, and then 4 years of residency in anatomic and clinical pathology. Now, at this point, you're getting paid, although paid in kind of like a resident salary. So this is actually kind of like working, but also education. And there's a couple of different pathways in here. One is you can do a 3-year residency in just clinical pathology if you know that you want to be doing stuff in the lab, or you can have a 3-year residency in internal medicine and peds, followed by a 3-year fellowship in hematology and oncology. If you want a really long pathway, yeah. And then if you're more surgically minded, then you can do a 5-year residency in anesthesia. And then after all of this, you can do a 1-year fellowship in transfusion medicine. Now, the places that you can kind of work after this are things like an academic teaching hospital, or a blood center, or a third-party pathology group. So in the blood center, you would do mostly kind of like the collections and distribution. And in a hospital itself, you would be doing mostly the transfusion side, which is where you're kind of like looking at adverse reactions that people can get. Some people also go into regulatory, like they go and work for the FDA, or some people work for industry where they're working for some sort of biotech company as well. And this is just an example of the kind of structure of a single laboratory. So, for example, you have the medical director, and then I am an associate medical director. But then over here, you have a bunch of, you have MLS and various different positions that they can have in terms of like more managerial positions, like the manager or quality manager, or a person who is a lead technologist. Okay, and with that, I will hand this over to Ray.
All right. So Dr. Tsang gave us a really great overview of the transfusion medicine and that side of the blood banking lab. So I just want to introduce to you a couple of the other areas of the lab that you'll also see within the hospitals. And I should mention, I'm one of the instructors in the medical laboratory science program for UW. And I have also been a generalist before as an MLS, which means that I've gotten to work in all of these different areas that I'm about to talk about. So let's jump into chemistry. So chemistry uses a lot of these really remarkable instruments that are able to do analysis of our blood or urine or other samples that can give us information about the patients. So they have these huge automation lines where you can enter the patient specimen in this area that's closest to the camera, and then it will automatically go down the conveyor belt and find the instrument that it needs to go to get the testing that's required for it. And it will even travel from one instrument to the next to make sure that it gets all the tests it needs, and then it will automatically be put in a little fridge for us. So there's a lot of really remarkable technology and development going into this, but it also requires a lot of help along the way from the MLS to make sure that the results we're getting are accurate, that they're precise, that they're going to be useful to the patient and give us good information. So what do we actually do in chemistry? Well, it's one of the largest departments by test volume. Actually, more than half of the tests ordered at UW are done in chemistry. So it's a really wide catch-all sort of category. MLSs will use our instruments to test patient samples. So that could be blood or plasma or serum. It could be urine, spinal fluid, all kinds of different things that we might need to analyze depending on what's going on with the patient. When we're looking at those different specimens, we're looking for analytes. That's a word that will come up a lot, and that just means whatever we're actually testing for. So that might be something like an electrolyte like sodium. It could be a blood gas like oxygen or carbon dioxide, different proteins, tumor markers, drugs, vitamins, all kinds of different things. Antibodies, so we get a lot of immunology information through chemistry. And all of this can give us insight into tons of different conditions. So some of the big ones are things like diabetes, pregnancy, heart attacks, liver or kidney disease, drug use, poisoning. It's all over the place. There are lots of different things that we can evaluate through chemistry. I should also mention, though we do a lot of automated testing on those big instruments, like I mentioned, we also do a fair bit of manual testing. So I've shown a picture of what's called an ELISA test here with all those blue wells. This is set up manually, sometimes with the aid of some machines, but it's mostly done by hand. And these can be set up to give us information about all kinds of different things. So it uses antibodies to test for pretty much anything you want, all kinds of different analytes that we could use. And the darkness of those wells tells us how much of that analyte is present in the patient sample. One of the other wonderful things about working in chemistry is if you're somebody who's kind of technically minded, mechanically minded, you like to get into an instrument and take it apart, make it work a little better, put it back together. We get to perform maintenance, we get to do quality control. So that means you're really kind of getting in there with your hands and making things work, which can be it can make it a really good fit for people with that kind of mindset. Last thing that you get to do in chemistry that I wanted to highlight is helping out in emergencies. So if a patient is in kind of a code blue situation where they're needing help right away, we have a pager in the chemistry lab that will go off and tell us where they are. We will take our blood gas analyzer, so that's this little instrument mounted to the cart, and sometimes literally run across the hospital to get to the site where we're needed. And that way we can give some lab information in real time as the situation develops, and then the care team can make decisions based on the information that we're providing. The next area of the lab I want to touch on is hematology. So hematology is blood related, but it's different than blood bank. So we're more looking at the components of the blood and how they look, how they're behaving, and analyzing for things like anemia or leukemia. Once again, we use a lot of automated analyzers to help us do this analysis, but there's also a great manual component to it. So we will make these blood slides. So you can see in the bottom left, that's a blood smear being made. It'll be stained and then read microscopically. So you can visually identify all the different types of blood cells and tell when there's something wrong with them. So that can help us provide information to the care team to make decisions, once again, about the patient. And then lastly, I have an image here of what's called an erythrocyte sedimentation rate. That's the picture right below the word hematology. And that's just a really general test that can kind of tell us about whether the patient's experiencing inflammation or not to a great degree. So if the red blood cells are falling down quickly, then that correlates to a greater degree of inflammation where there might be something going wrong with the patient, versus if the cells are staying kind of higher up instead of floating downward, then that indicates that they're probably normal in that regard. So there's a lot of different things that we can do in hematology. So what actually happens in the hematology department? Again, we use instruments to test our patient samples. We can also do some coagulation testing. So we're looking at whether a patient is able to make blood clots. Oftentimes patients undergoing surgery or things like that will have anticoagulants given to them, or different treatments they'll be given anticoagulants, and we want to make sure that that's at the right amount so that they don't bleed too much. We can also microscopically examine our blood, so I'll show you some pictures of that in a moment. And there are some really specific diseases that we can help to identify using these testing methods. So lots of things like anemia and leukemia, bleeding disorders, like I just mentioned, and some things that are less obvious. So things like lead poisoning or vitamin deficiencies, infections, inflammation, a lot of things you can get information from by doing hematology tests. So this is kind of what a normal blood smear, or the normal components of a blood smear, should look like. So on the left, you can see some red blood cells, or little pink donuts. They look pretty normal and happy. That's how we'd expect them to be. There are also white blood cells. So there are 5 different major types of them that you can find in the blood. And they all do kind of different things. So some of them are there for fighting bacteria. Some of them are for fighting parasites. Some of them are just kind of general roaming around and cleaning things up. But this way we can identify them and see if they look the way that they're supposed to. And if they don't, that morphology, that appearance, can tell us that there's something wrong with the patient and help give some direction for treatment. So these are some examples of what you might see if there's something going wrong with the patient. So in the upper left, this is an acute leukemia. You can see that there are a lot of white blood cells. There are more than there are supposed to be, and they don't look like the other ones that you just saw. They look abnormal. And so some of the different appearances of these cells can help us determine what sort of leukemia the patient has, which can give information about what sort of treatment will actually help them properly. You can also get information about things like bacterial infections. So in that right-hand image, that patient is experiencing a bacterial infection, and they have lots and lots of neutrophils, which are the type of white blood cell that fights bacteria. So that makes sense. They're responding to that bacterial infection. And they also have all these extra little dark granules inside of them, because that is going to allow them to attack the bacteria when they find it and hopefully kill them off to protect the person who they came from. Lastly, at the bottom, I have sickle cell anemia, and that's a really literal name. So you can see some of those red blood cells are shaped like little sickles because their hemoglobin isn't shaped correctly. So it's causing those red blood cells to distort, which can also cause them to be destroyed and cause anemia, where the patient doesn't have enough red blood cells. All right, next slide, please. So the last department that I want to touch on quickly is the microbiology department. For me, this is my personal favorite. You get to kind of engage all of your senses and do a lot of problem solving and figuring out what's going on for a patient to help them out. So let's go to the next slide. We'll talk about what that's like. The main things that we do in microbiology, we'll make cultures of our different sites to grow different organisms. So it might be like a respiratory culture, you could get like a throat swab, or you could grow a urine culture if somebody might have a urinary tract infection, and all kinds of different things we can do. And we grow them on agar plates that will look like the upper right-hand image. So in that image, you can see there are a lot of different organisms all together at once. And we can separate them out and try to identify them. We also do antibiotic susceptibility testing to decide what antibiotics will actually work to treat certain organisms. So that's in the bottom right hand, you can see there are these little paper discs that we put down on a plate covered in bacteria. And if those antibiotics are able to kill off the bacteria, we can use that to determine whether they'll be good drugs to help treat the patient. We can also do fungal and parasitology evaluations. So on the bottom left, there's a fungal culture. So you can see it's an organism called Sporothrix that can grow. And so just like bacteria, fungi can sometimes cause infections. And parasites can also cause infections. So in the middle image there, you can see a little picture of a Giardia organism. And I kind of like finding that one. It's bad news for the patient, unfortunately, but it is, I think they're kind of interesting to look at. And that's often the case with some of these microscopic evaluations. They can be really interesting to see. So we identify our organisms using a whole bunch of different testing. We'll see how they look on the agar when we grow them. We'll see what gram stain they have. So if they're positive, they're purple. If they're negative, they're pink. We'll do some different biochemical tests to see how they react. So there's all these wells at the bottom that turn different colors, or a catalase test at the bottom left where it'll bubble if it's positive. Antibiotic testing, in my opinion, is one of the single most important things that's done in the microbiology lab, where we make sure that the antibiotics the patient gets are going to actually treat them appropriately. Because if they get the wrong antibiotics, that can make the organisms that they have more resistant to antibiotics. So this can be just a really important thing to do for healthcare in general, to make sure that we conserve our antibiotics and that they keep working in the future, as well as making sure that the patient themselves are getting the correct treatment that they should be to make them feel better. So there's so much more that I could say about all of these different departments. I'm going to cut it short so that we have time, but I just wanted to, I hope you feel like you've gotten a little bit of a taste of the different things that medical laboratory scientists do. And thank you so much for joining us.